Now we have the clinical features of Parkinson disease. In Parkinson disease, you have the motor features, the typical motor features, and the non-motor features. The first feature, that is the bradykinesia. Brady means slow, like in tachycardia and bradycardia, like slow heart rate and fast heart rate, brady. Hypokinesia is still the same thing. Hypo means also slow or low. Kinesia means movement. So there is a slow movement in these patients. Now, these patients, when they have slow movements, they will have, when they walk, they will have a shuffling gait. Shuffling gait stands for small stepped walk, right? So they will have shuffling gait here, right? And they will have tremors. The tremors are usually in the limbs. It spares the head but involves the jaw and the chin. And these tremors are resting tremors. They appear at rest and they disappear when you start movement. Next is rigidity. Now, rigidity is increased in tone. When the body muscle tone increases, you have the rigid figure. The rigidity is mostly cogwheel rigidity. When you try to uh, flex the elbow, it there is increased resistance throughout, and it's the same, right? So there is rigidity, and because of the increased tone or rigidity, the people in Parkinson disease will have masked face and stoop posture. Okay, they will have masked face and stoop posture. They also have flexion of elbow, wrist, or knee joints. Now, these patients, when there is progression in the disease, they tend to fall. So that's because of the postural instability. They fall and they need a support to walk and right. So then we have the non-motor features. In non-motor feature in Parkinson disease, you have dementia. It's probably that there is atrophy of the cortical neurons due to abnormal protein deposition there as well. Then you have anxiety and depression, and there is sleep disturbances and smell disturbances in these patients. So we have a mnemonic here. Now, this mnemonic that I use to remember, mnemonic is parked. Okay, put E here, parked. Okay, so this mnemonic uh, here, P stands for posture, which is stoop posture or postural instability. Okay, aged stands for older people, like this disease tend to occur in older people. Rigidity, which is one of the clinical feature of Parkinson disease, and the another R stands for resting tremors, right? So the resting tremor is very important to remember. Kinesia, in kinesia you have bradykinesia, right? Maybe hypokinesia or maybe akinesia, right? So then if you turn the E to the other side and draw like this, it can represent 3, and 3 can represent I mean 3 D's, right? 3 can go for 3 D's, and 1 D is for dementia, the other D is for depression and anxiety, the other D is for the disturbances of sleep and smell in these patients. Now, this is how I remember. I hope it will help you remember as well. Thank you for watching. Bye.